Hello, and welcome to Medicare Made Easy. This is a broadcast from Blue Cross and Blue Shield of Louisiana, and we're going to talk about summer tips and some fraud information. So please stay tuned so that you can learn all this important information. My name is Ann Booth, and I'm a Medicare benefits specialist for Blue Cross, and I love helping people that are turning 65 on disability, or they currently are 65 and need to know more information about Medicare. So that is what I do. And I would like to introduce you to my cohort, Khali Crumpton.
Hey, everyone. My name's Khali Crumpton. I am a Medicare benefits specialist also. A little bit about what I do is just ensuring that people that are eligible for Medicare's Part A and B have a good understanding as to what their options are. They have a good understanding on how our plan works in regards to doctors, drugs, benefits. More than that, I mean, yes, I'm eligible to sell you the product, but more, I just want you to really, have a great understanding of what the plan offers for you. Now, we do appreciate you for taking some time with us to spend with us to talk about some of the hurricane preparedness. And as Ann mentioned today, we are talking about summer health tips. And one important one for us is the hurricane season. Hurricane season begins in early June, and it's going to be rolling all the way through late November. The heaviest months of the storm tend to be August through October, but, you always want to be prepared for hurricane season. So as the season gets underway, we hope for the best, but, you want to prepare for the worst in regards to a storm coming. And with seniors, that is extra important. It's really challenging for a senior to deal with a hurricane, and that's an extended period. So things that you can do are think ahead about the plan and your health needs in the area and the tropical weather. And what are some hurricane preparedness tips we should keep in mind?
So I know, Khali, we tell some of our members, especially if they're on insulin, they have to keep that refrigerated. So we want to make sure that they make a plan. It might be with your friends or your family, but always make a plan because it's important. They don't want to lose power. Like if they have oxygen tanks or they have power wheelchairs, we really have to be cautious for you all for that. So also they might live in an assisted living facility or independent facility. And sometimes I know you all will evacuate for that. But make sure if you go with your family members, your facility knows where you're going to be because they may be really concerned. So I know, Khali, we have people that'll ask those kind of questions. So, what if you have a generator or a family member has a generator? You could go to their house, but always know ahead of time, be prepared. That's what they always say. You can get your medicine. If we know a storm's coming, you can get your medicine ahead of time as well. So like if I was evacuating with you, Khali, I'd make sure we make a plan. We know ahead of time, like we're going to leave. If the storm's getting this close, we're going to leave this far out in advance. So it's just important to make a plan. So, yeah. And so, Khali, what other tips might you give for hurricane preparedness?
Well, a good thing to do is first and foremost, you want to keep your ID cards handy. Whenever you're leaving the house, you always want to make sure you have your Medicare card with you regardless. But especially in hurricane times, you want to make sure that you have your ID cards with you. Now, another good idea is, prescriptions that you're taking. You want to make a list of them. Maybe you'll save it in your phone under the notes section. Maybe you'll write it down and you'll put it in your purse. But you want to make sure that you have a list of your purse or your wallet. You want to make sure that you have a list of the medicines that you take, dosages, so that in the event of you being away from your home, you're able to, kind of know what medicines to take, because some people take a lot of medicine and it's not easy to remember everything.
Right.
It's also a good idea to put that list, like I said, in your phone or your wallet or somewhere. So when you do evacuate, you can just grab the essentials and go, and your list will already be there with you. Now, another thing is when you get your prescriptions filled, you would want to try to get all of the essential prescriptions with a 90-day supply. So that way, in the event of you being away from your home and you're not able to go back, you will at least have some medicine before you have to reach out to a foreign pharmacist to try to get drugs. So the important drugs, I would definitely say try to talk with your doctor, get a 90-day supply for these drugs, so that way you can, have them on hand in the event of an emergency.
That's great.
Now, if there are any concerns about taking your medication or your ability in a severe weather situation, talk to your healthcare provider or your pharmacist about that in advance, so that way you guys can have a plan in place. Now, Anne, can you share your virtual options to get with healthcare?
Sure, and those were all great tips. So some virtual options, we have telehealth, and if you're one of our members, we have that information available. If you're not sure, you can call your agent. You can also call customer service, because it'll tell you how to upload the app on your phone or your smart device. As long as you have access to internet, then you can see a telehealth provider. So we have signature providers that are available to you. You also, if you need a mental health visit, you can do that as well, which is great, because I know times can be really stressful right now. So that is something that's also available to you as well. And they can call in prescriptions for you. So if you're in another state, all our 50 states, you might have traveled out of town with family and things like that. So they can send in prescriptions for you as well, which is really important, because we don't want you to go without your medicine. So, yes. So that's some things that we feel like are really important to you. And we're here to help with any of those questions, because I know it can be a little confusing how to put that or how to set up that appointment, but we do have that available for you. So, Khali, do you have any other advice on natural disasters or anything like that if it comes about?
Well, what I do want to do is I want to reiterate the information about hurricanes and natural disaster as far as a crisis situation. And I want to be real clear, so I am looking at my notes to make sure I get this correct for you. On our website, which is www.bcbsla.com, you can go there and we will have responses. So in the event of it being a crisis situation and you don't know what's going on, go to our website, www.bcbsla.com. And you'll be able to get important information about hurricanes and what we're doing, to help you in those crisis situations. Now, you can also follow us on our other social media sites, bcbsla.com, to check news and information. You can also check, to see if there's severe weather in Louisiana. You can also check through our
site. Because, it's important. We don't want somebody coming back, like Khali said, if the storms are really bad, Khali. So we want you to be safe when you're traveling.
Yes. Now, in addition to hurricane season, June is also our Medicare fraud prevention week. And we want to share some tips that will help you recognize and prevent fraud. Unfortunately, older adults are more likely to be targeted for fraud and scams than younger groups. So with that being said, people 60 or older get about at least 84% of the fraud cases. And, so you do want to kind of be prepared. So what you want to do is you want to, make sure that friends, family know what's going on with your situation as far as giving out information to somebody. It's okay to have a conversation with your son or your daughter or your loved ones. Hey, I just got a call from so-and-so and they wanted this information. It's okay to verify with somebody. Never just give your information out to anybody. So that is one tip that I would like to share with people in regards to fraud. Now, Anne, can you share some fraud warning signs and explain what to look out for?
Sure. So to piggyback off of what Khali said, I know our members will sometimes call us. I got one the other day. It was a person that works for Blue Cross, and they were wanting to check on them, set up a home visit, and the lady was really concerned because she said, I talked to my agent, Anne, and she would let me know something like that happened. And I said, no, they are with Blue Cross, but you can call us anytime to ask those type of questions. And recently, Khali, what happened is my aunt, she was a victim of fraud to her Medicare. And so she had been looking on her evidence of coverage. And so she reached out, and we reached out to the fraud department because they're billing Medicare, and she was receiving services that she had never had done. So that's very important. Also, too, if somebody calls, because there's so many scams out there, foot bath, diabetic, all type, make sure before you give them information, you want to reach out because it's so important. We don't want you to go through having to deal with that. And ask your kids, like, somebody didn't know that they were going to have to give money, but you don't give that over the phone. So you reach out and make sure that you're okay, because there are so many scammers out there, and protect yourself. And I'm going to give you our fraud hotline number. It's 1-800-392-9249. And it can be anonymous or you can speak to somebody, but we want you to know that we are here to help you for sure. So I know, Khali, this month is Fraud Prevention Month, and so it's been really important to get this information out. Now, is there anything else that you would like to say before we end this?
Well, I do want to say, Ann, thank you so much for joining me this summer for this educational event for the audience. If you want to share this Medicare Made Easy live stream with others, we'll post a video to our Facebook page and to our YouTube channel, the Blue Cross YouTube channel. And speaking of YouTube channel, that's where you can go to see our Medicare Made Easy YouTube videos, playlist, which has a playlist with short videos from in-house experts, including a Medicare 101 video. We also have a fraud prevention tips video playlist that you can check out on YouTube as well. And it helps you with spotting and stopping fraud. Thank you for joining us, and have a wonderful day.
Thank you.